Hi, welcome to Dermabare. This is Ramin Tayani, ophthalmologist, board certified, and oculoplastic surgeon. I'm the medical director at Dermabare, the med spa in Laguna Niguel, located at Lifetime Fitness Athletic Center. We've been in business since 2009. However, I've been in business since 2000 as a ophthalmologist, oculoplastic surgeon, doing all kinds of aesthetic and reconstructive upper face work. In 2009, I started Dermabare, and at Dermabare, we do all kinds of aesthetic services, including injectables. And this session, I'm going to be talking about injectables. So there's two classes of injectables: things that stop muscles from moving, and things that fill spaces, hollowing, or areas like the nasolabial fold, where there's depth. So in the class of the muscle movement chemical, there is the main one that we've all heard about in many, many years is Botox, but we also have Xeomin and Dysport. We've tried them all, and we've chosen to stay with Botox because we feel that they all have actually pretty equal effectiveness. And actually, I'm going to give you a little background. Botox was started in the world of ophthalmology more than 50 years ago as a way to stop moving the eyes for double vision in certain directions. It didn't really work very well in that world, but then fast forward a few years, and it was used for a condition called blepharospasm and or hemifacial spasm, a medical condition where the muscles go into a significant twitching, cramping kind of a modality, and Botox was just fantastic and worked really well for that patient population. After years of use, we found that the patients were losing their wrinkles in the areas that the Botox was used. So some smart people decided, well, there's a lot more people in the world that want to look beautiful than have blepharospasm or hemifacial spasm. So the industry exploded, and the word Botox became a household product. So the way Botox works is when there is an action of a muscle, for example, when we frown or raise our forehead or smile, those actions create, the muscle movement creates lines. They're 90 degrees or perpendicular to the motion of the muscle. So if we're moving our forehead up, the line is a horizontal line. In our glabella, or the mid-eyebrow area, when we're frowning, we're moving our eyebrows in, the line is vertical to that. So by putting Botox or any of the chemicals that inhibit the muscle action, we're actually stopping the movement. So over time, the line fades away because the muscle is not moving anymore. As opposed to fillers like Juvederm or Restylane or any of their sister products, which is a significant number of names, I'm not going to put them all out there, but those products actually have nothing to do with movement. They are fillers to fill the space that we want to fill. So whether it's an indentation because of a scar, or it's a nasolabial fold, or marionette lines, or we just want to lift the cheekbone area, or some people call it a liquid facelift. These injectables can help. I personally believe in a combination therapy. The most successful outcome of an aesthetic result is typically when you combine multiple things, whether it's combining Botox, fillers, lasers, surgeries, depending on the indication and the interest and the issue. Our job as doctors and nurses and consultants is to identify the problems that the client patient is asking for in making our best recommendation. As far as before and after care for the injectables, the good news is there's really not much. In my opinion, Botox, once we inject it, the only thing I ask my patients to do is to use the muscles that we just injected. So if we put injections into the mid glabella or the mid eyebrow area, I want you to use those muscles for the next hour or two. Same thing with the frown line, the forehead lines, etc. So use the muscles. That's it. You don't have to do any icing. You don't have to be in a certain position. In my opinion, that's fine. Some doctors, some providers do feel that those other things are important, but in our patient population, we don't care about that. Injectables, the only thing to consider is that there might be a bruise. Same thing with Botox. It can have a bruise, but it's very uncommon. But bruising can occur. If it happens, usually 5 to 10 days. So typically I tell patients, if you're going to attend a wedding on the weekend, don't do this procedure on that Thursday or Friday before. but a couple weeks before it is fine. Typically, a month before is ideal. That way, if you have any bruising or anything, it will go away by then. The other main thing to consider with Botox as a possibility, especially in the eyelid, forehead area, is a rare complication of a droop of the eyelid can occur. And the good news and bad news of Botox is it's temporary. So if it does happen and you do get a droop, know that it will go away. And it does take potentially up to 3 months. But most of our patients, we found that within a few weeks it's better. There are some medications that we could use to help that. So if that does happen, do come in and we'll talk about it. As far as the injectables, like I said, the results are immediate. Once you put in the filler, in fact, you're going to be overcorrected for the first 72 hours because there's also some swelling involved. However, with Botox, it does take about 3 to 4 days for the Botox to kick in. Usually you see the maximum effect of about 1 to 2 weeks, and it does last for anywhere between 2.5 to 4 months. Every patient is different. Some people metabolize it quicker, some people keep it in longer. So depending on your history, we'll know. Basically, it's very patient dependent. So these treatments, coupled with any of the other services that we provide and or on their own standalone, do very well. We typically have specials throughout the month or weeks. Look out for them on our site, dermabare.com. Dermabare is DERMABARE.com. Again, this is Dr. Ramin Tayani, Medical Director, Dermabare. Have a great day. Thanks for watching.